Lesotho started implementing the Global Fund grants to fight HIV and AIDS, TB and malaria activities in 2004 with around 2 HIV and TB grants. Since then, Lesotho further implemented round 5 HIV grant, round 6 TB grant and round 7 HIV grant. Recently, Lesotho proposals for round 8 HIV, health strengthening system and TB grants as well as round 9 HIV grants were all approved, and their implementation will start soon after the release of funds. The main aim of round 2 HIV, AIDS and TB grants was to strengthen prevention and control of HIV, AIDS and TB in Lesotho. In collaboration with other partners, round 2 HIV grant assisted the country with additional human resources specifically for HIV testing and counseling, establishment of ART centers and mainstreaming prevention of mother-to-child transmission program in MCH services.
Ke ka dio tseba mo ba ka 2008 sentse ke le mogachane jwale se sora sa ka fumantsha la go se tlase ka be ke nwa dipidisi tsa bophelo bohle ngwana le ena a fuwa moriana wa hahla a kgone ho nwa ke leboa mmuso le bafani ka hore fa dipidisi gore phele hantle.
Because of Global Fund assistance and other partners, the HTC sites increased from 10 to 224, and this improved access to HIV testing.
Ho bonahala batho ba se bana le kutlwisiso ya go tseba boemo ba bona mme ba hlahloba ka bongata haholo ba bang o tla fumana hore a se le taba o bane e le mokhatshane le pele a ka tla qala clinic o tla santsa tseba boemo ba hae.
Currently, 612,065 people tested for HIV countrywide. In partnership with government and other donors, Global Fund contributed to increase ART centers from 4 in 2004 to 186 in 2010, and this enabled AIDS patients to access ARVs and STI drugs at zero cost.
NDSO is the Central Medical Store of the Ministry of Health and Social Welfare, and as such is assisting Ministry of Health as the sub-recipient of the Global Fund. We are assisting Ministry of Health in terms of procurement, storage, and distribution of the health sector goods funded by the Global Fund.
More than 50,000 AIDS patients are currently on ARV treatment countrywide. Round 5 grant also focused on HIV and AIDS, mainly strengthening activities that started from round 2 implementation. Through round 5 grant, HIV testing and counseling services were expanded through deployment of additional professional counselors to improve HTC. Out of 195 health facilities, at least 188 facilities, namely hospitals, health centers, and private clinics and surgeries, have at least one professional counselor in place. The incentives for health workers was also introduced by Global Fund under Round 5 to motivate hospital staff to be committed to the work of caring and supporting patients, especially this time where they work at high risk due to transmittable diseases such as TB and HIV. This helped to improve provision of quality treatment of HIV, TB and STI services. Through Global Fund, the new ART centers of Buthabute and Parei Hospital were constructed and procured office furniture and medical equipment. Apart from these two, other ART centers around the country received office furniture from Global Fund grants.
We are able to provide services smoothly in this building. Before, the building was very small. We are having 2 consulting rooms. We have 6 counseling rooms, and that helps us a lot with the adherence counselings and counseling for general patients.
In order to prevent HIV transmission to unborn babies, PMTCT service sites were increased from 35 in 2007 to 136 in 2008 and 188 in 2009. Currently, all 188 facilities integrated the PMCT program in all routine mother and child health services by offering minimum package PMTCT services to HIV-positive pregnant women. About 95,432 pregnant women cumulatively attended clinic and tested for HIV in order to prevent mother-to-child transmission. At the moment, more than 6,000 HIV-positive women around the country receive prophylaxis to reduce the risk of HIV to their unborn babies. Meanwhile, There are 3,539 children aged between 0 and 14 who are currently on ARV treatment. Apart from HIV, there are grants that focused mainly on TB. The first is Round 2 TB grant that has also had remarkable results of health patients and the health sector as a whole. Through this grant, 1,476 traditional healers and 849 healthcare workers were trained on TB. Traditional healers who used to claim to treat TB were trained and are now working jointly with the Ministry of Health by referring their TB patients to hospitals. This grant contributed to strengthen DOTS and the integration of TB in HIV program, which yields successful results in TB treatment.
Ke ile ka kena thupelo ke ka 08 re rupelwa ka HIV and AIDS le TB. Mme rona re le batho ba moetlo nna bakudi ba ka ha ba ne ba fihla lapeng ke ne ke ba fa ditlhare tsa sejeso jwalo ka ha re Basotho re TB ke sejeso ba nkile nako ke ntse ke ba fa ntho tseo tshene re so utlwele ka thuto yena re so itsebe ya TB.
Other achievements of TB grant are procurement of laboratory equipment, the establishment of laboratory quality assurance system which is now functional, and the extension of laboratories to create space and ensure safety of health workers. Round 6 is also a TB grant. This benefited both TB patients and health workers since the project's inception, in particular improving on TB diagnosis. Ministry of Health was able to increase the human resource by recruiting 20 microscopists whose duties are to examine sputum samples for TB. Their presence has had a huge positive impact on the program since the number of cases diagnosed per day has increased. One noticeable benefit of this is the fact that patients can now get their sputum results the same day that they send them. The importance of laboratory refurbishment and extension cannot be underestimated. These particular laboratories were very short of space, and this refurbishment has extended their capacity considerably. Additional transport of vehicles and motorbikes have also improved default tracing. Apart from medical assistance to combat TB and HIV clinically, the Global Fund grants also contributed to help the country to prevent spread of HIV and mitigate the impact of AIDS among orphans and vulnerable children in Lesotho. To prevent HIV among youth, Global Fund supported the expansion of life skills education in and out of schools, promotion of sustainable food security and livelihood interventions, scaling up of child helpline services, and strengthening of CGPU of Lesotho Mounted Police Services.
Global Fund ka tsela e kgethehileng ka equipment ba re fileng yona bakeng sa hare ya di-patrol go le kwanana metseng ya Basotho re kgona go re le mono be re na le mattress ya rona re na le sleeping bag, we have all the stuff go re hlile hona jwale ka nnete re iphumana re na le equipment re hloka mme re le ba Global Fund ka tsela e kgethehileng.
Other Global Fund support to OVC include provision of school fees, stationery and examination fees for secondary OVC, and providing bursaries for OVC at vocational training, as well as support to OVCs with special needs such as visual, speech and hearing disabilities. The total of 450 vocational students and 3,183 high schools OVC were supported with school fees in 2009.
Among other institutions that we are having, Global Fund has helped us with quite a number of assistance. Now, in this one, this is a center and it's providing technical skill. It is providing us with quite a number of equipment for these centers and technical institutes in the country. And again, we have been provided with bursaries for students. Right now, we are having more than 500 students that are being helped by Global Fund.
I don't have both parents, mother and father. I am sponsored by Global Fund. So I'd like to thank Global Fund for helping me to continue my education.
Equipment such as computers, vocational tools and teaching aids for children with disabilities were procured to improve quality of education in all schools.
The Global Fund has purchased 13 computers, and then we have inserted the JAWS as well as the Duxbury, and we are in the class of those learners now. The materials were so expensive that the ministry could not afford it, so we are thankful for Global Fund.
To create enabling environment, more than 5,352 OVC households were provided with different essential services including food packages, clothing, mattresses, blankets, seeds as well as garden tools to produce their own vegetables. Other orphans were assisted with house renovations, while those houses that are beyond repair received a new 2-roomed house. Generally, Global Fund grants contributed significantly to strengthen Lesotho health sector with the necessary capacity to deliver quality services in HTC, PMTCT, ART and TB. The impact of Global Fund grants, particularly to the number of lives that were saved for both adults and babies, and the number of individuals that have now returned to being productive members within their families and communities have now been profound. Not forgetting the number of orphans and vulnerable children that received education with the support of Global Fund.
Red Cross e re file dikrewae le dikgarafu le uniform le dijese le dijeta. Re Red Cross le bafadi ba yona ka dintho tseo ba re fileng tsona. Bana ba file uniform se le ga fuwa le dijo le grocery makgetlo a mabedi.
Thank you to the Global Fund. You've transformed not only the lives of the infected and affected, but the infrastructure and the health sector as a whole to combat the two diseases, TB and HIV, and mitigate the impact of these diseases to the OVC.
We are really very thankful. Global Fund, you have helped us a lot.
Global Fund ka tsela kgetheileng.
Global Fund hobane ke yone nthusitseng hore e be kwana.
We thank Global Fund for doing that.
And then we are thankful for Global Fund.
Thank you, Global Fund. May God bless you.